A lot of people are in a ton of pain and they're reaching out for help. I have with me Dr. Frost, and he's the owner of AZ Regenerative Medicine. Tell everybody a little bit about yourself and what you do.
Well, I'm a chiropractor and physiotherapist. My major's anatomy, and I've been in neurology for many years. Been in nutrition since I was 12, and I'm 54 now, so that's a long time. My clinic is it's a regenerative medicine. It's integrative, so we have a naturopathic medical doctor there, and we help people get out of pain, get off of drugs, and avoid unnecessary surgeries whenever possible. First of all, we do a proper evaluation, so the patients actually will come into the clinic and we'll do a consultation. Normally we don't charge for it if they'll mention this show or this YouTube channel, and we'll go ahead and do a complimentary even examination on their primary care. We'll make sure that they fit the right, they have the right fit for the solutions that we have. We want to make sure we look at x-rays and MRIs. We want to do all of our proper diagnostics to give them the right solutions. If we can't help them in the clinic, then we'll find the right people to send them to, whether it's, some people have to have surgery. Sometimes this won't fix them, and so we want to make sure we leave no stone unturned to find that right solution for them.
Doctor, I know that you're passionate about something that some people don't really understand, and I'm really glad that you're here to be able to educate the public on stem cells.
Yes, regenerative medicine, it's amazing. People don't realize it's been around since 1963. In 1908, it actually was first theorized there was a cell that duplicated over and over again to make us us. In 1968 was the first bone marrow transplant for stem cells, and that it continually progressed until now. We have regenerative medicine with amniotic tissue, bone marrow stem cells, fat stem cells, lots of different options to be able to regenerate to, again, my motto is pain is not a lifestyle, so I try to help people change that lifestyle and get rid of the pain by using this state-of-the-art, basically old world solution, which is you and I.
So, okay, a lot of people don't understand it, and one thing that they want to know big time is if it's safe.
Oh, absolutely. So the amniotic tissue is taken from a placenta from women from the ages of 18 to 35, and these are done with scheduled cesareans. And the reason that they're scheduled is because the tissue has to go through a proper process that the FDA guidelines are recommending by the Association of Tissue Bank folks that have been trained properly to make sure that it's a sterile environment and done correctly every time. So the proper questions are asked to make sure that the medical and the social history line up to be safe. They do blood testing, make sure there's no pathogens that can be passed to you. And so it's 100% safe, straight across the board.
Well, let's talk about some of the things that it can help with. You know, you say bone, but I mean, I said bone. Bone on bone. Some people have that problem. Can it help with that?
We've seen it help, and I've got testimonies that will blow your mind that these, by all typical medical surgical prognosis, these people really should have had their knees replaced or their shoulders replaced or even hips, and we're actually getting them out of pain, walking a mile briskly within 5 to 6 weeks. This one gentleman, he had it for 20 years, and about 2 weeks ago he's actually walking, no pain at all. He's 81 years old, so don't let age stop you. Please, I got 94-year-olds, 16-year-olds, 13-year-olds, all ages. This can help everybody. You're made with this tissue. It duplicates over and over again. So when we can target and find that right solution for you, and we can make sure that it gets in there the way it's designed, and you do what you're supposed to, you're going to have the highest probability of changing that lifestyle from a pain is not a lifestyle to active is now my lifestyle.
So, okay, let's talk about this. Hips. Because a lot of people, their hips, spine, any area?
Musculoskeletal joints, yes. We've even done TMJ, the jaw, in order to help somebody with a nasty disease called trigeminal neuralgia. You guys can look that up. It's a whole other segment. But the hips, the knees, knuckles, we've done knuckles, wrists, yes, shoulders. Oh, shoulders are amazing. If we can get a hold of a shoulder and we can diagnose it properly with MRIs and get this tissue handled and then do some proper physical therapy and balance it back out again, the results are amazing. We have people who have thrown baseballs for over 50 years that couldn't throw a ball anymore, back throwing again.
Wow. Well, what's the downtime on it?
You know, there's really no downtime. It's not like surgery. I was talking to a gentleman earlier, and he was telling me that it took over a year for his knee to actually completely get out of pain. My dad, who had surgeries, and other people have surgeries replacing their knees, and sometimes their downtime is 2 to 3 months. And so when it comes to the amniotic tissue, we really want you back in your normal lifestyle, going to work, enjoying life. Take it easy for a couple of weeks. Give these little guys an opportunity to build. You know, let's not put a tire on their back and tell them to climb a mountain, right? Let's unload them a little bit. The next 3 to 4 weeks, generally people get back to about 50% of their lifestyle. And then the weeks 5, 6, and then the first, third, up to maybe the 6 months, people generally are doing very well.
It's amazing. Now, how many treatments do they have to have? Does it differ for every person?
No, generally they get one injection in the right location, and as long as they will follow the protocol that's designed for them, eating healthy, staying away from sugars and alcohols, coffees, drinking lots of water. All this is really important to rebuild the body. It was important before you got damaged. It's more important now to give these guys the opportunity, the building blocks they need to rebuild you. Drinking lots of water. So when you come into the clinic and we help you, what's going to happen is you're going to be educated on the right way of doing things. We're not going to try and flip your world upside down. What we'd like to do is take your world that it's in and do gradual changes that you can live with to give you the best prognosis. Sometimes we have to use knee braces, but they're not forever. It's short-lived. I'll take them through physical therapy exercise specifically designed for their damaged joints. We have even acupuncturists in the clinic. We have other things that we can do that will help to mitigate that pain of the muscles that are now trying to adapt to that new rebuilding joint that has been compromised for so long. We have so many solutions. The most important thing is to call the clinic.
I was just going to ask you, what would be the first thing that they should do?
Well, I would call the clinic. I'll call 602-992-2656. That's 602-992-2656. If you'll call up and mention that you saw this here, we will be happy to help you at no charge to find out what the solution is.
Well, give them a call. And there's so many people out there that I know are in tons of pain. It sounds like you can almost do anything. Carpal tunnel.
Yes.
Okay. I mean, because you said that. You said the
wrists.
The wrist.
Yes.
Okay.
Yes.
You said your jaw or TMJ.
Yes.
Okay. What else can they give them some other ideas of what different areas that you can work on?
There's not an area as far as joints go that we can't work on, or at least try to find a solution for. We do ankles, feet. It really, you need to come in and find out let's find out what the problem, what are your goals? And let's see what we can do to meet those goals.
Doctor, you say that pain is not a lifestyle.
Correct.
And you shouldn't live in pain.
No.
All you have to do is give them a call and they're going to help you.